Good morning, class. Today we will continue with obtaining vital signs and measurements. I know I haven't done one of these videos in a while, so let's talk about, let's kind of review what we talked about in the previous videos that I've done before. Again, this video is sponsored by 5-Star CPR. For all your CPR needs, 5starcpr.com. Learning outcomes. Today we'll recognize common terminology and abbreviations used in documenting vital signs. Describe the instruments used to measure vital signs and body measurements. Explain the procedure used to measure vital signs and body measurements. Okay? Vital signs. Of course, we talked about this before. There are 5 initial vital signs we're going to talk about: temperature, pulse, respirations, and blood pressure. Okay, there are baseline numbers that we go on initially when we initially see a patient, be it in a doctor's office or a emergency room or what have you. Okay, we have body measurements: height, weight, head circumference. Now let's talk about head circumference. Head circumference we're not going to do at this point. We're just going to mention it as one thing that you might do in a pediatric office. All right. Temperature. Vital signs and body measurements are used to evaluate health problems. Accuracy is essential. Okay. Provide information about a patient's overall condition. Take each visit and compare to baseline. Okay. All right. So yeah, we can compare each visit to baseline. Okay. We can compare each visit to baseline. That's fine. However, once the person initially comes in and we have some organic or specific vital signs to that patient, we're going to use that patient's vital signs to compare. All right, not throwing the baseline vital signs out the window. However, we're going to use those to compare. Okay, all right. Sorry. So let's go back to vital signs. Since we're reviewing, our baseline temperature is going to be 98.6 degrees Fahrenheit. Okay? All right. Our pulse is going to be 16 to 20. I had this problem last year. Sorry. 16 to 20 breaths per minute. Okay? Don't confuse that with beats per minute. It's going to be breaths per minute. Okay? So now when we come down to respirations, that is the way we breathe in and out, that will be between 60 and 100 beats per minute. Okay? So our baseline blood pressure is what? 120 over 80. And I'm writing it this way so I can be specific in saying this is my systolic, this is my diastolic. Okay? Systolic and diastolic. All right? Those are just what we start with. The patient may not be that in the end. Okay? But that is just what we're going to start with. Okay? There's a whole nother section on blood pressure that we're going to use to determine whether a patient is hypertensive, things of that nature. But for right now, we're going to just use these numbers for our baseline. All right. Our height and weight. Height, we're going to measure in inches. And weight, you can do it in pounds. Man. Sorry. Weight, you can do it in pounds or kilograms. Pounds or kilograms, okay? And you will have some math where you'll have to change or convert pounds to kilograms or kilograms to pounds, but we'll go over that a little later, okay? Sorry for the screen moving. My wand isn't charged up, so I'm having to do it the old-fashioned way, okay? Provide information about a patient's overall condition. I think we talked about that. Taken at each visit and compared to baseline. Use standard precautions. Always use your gloves or something when you're touching your patient. Okay. Protected health information or HIPAA. Okay. We'll get to HIPAA later. That's down the street just a little bit. Okay. All right. Febrile. Febrile is a body temperature above the patient's normal range. Fever, sign of inflammation or infection. A lot of times if a person has a persistent fever, especially over 100 degrees, it may be a sign of inflammation or infection. Okay? Not necessarily all the time, but that is one indication that you may use for that. Hyperpyrexia, extremely high temperature. Okay? Afebrile, normal body temperature. Body temperature varies with the time of day. Okay? Anytime you have A in front of anything, that's usually normal for someone. Okay? Temperature routes. Okay? Temperature routes. You have oral, tympanic, rectal, axillary, and temporal. Okay? All measured in Fahrenheit, or you may get it in Celsius or centigrade. Okay? Normal adult temperature is 98.6 and or 37 degrees Celsius. On a quiz, I may ask you both. Okay? So just because I put 37 degrees Celsius, you should know that it means 98.6 degrees Fahrenheit. Okay? Temperature can be measured manually, electronically, or it can be measured with a temperature thermometer. Okay? If you notice, routes are different. There's different temperatures for different routes. Of course, your oral is the one that's been the most explored because we're in COVID. The temporal is probably going to be the one that's most used, or the laser. Okay, tympanic, rectal, axillary. Okay, you have those in your PowerPoint that I've sent you. Measure to the nearest 10th degree. Oral temperatures. Wait at least 15 minutes after eating, drinking, or smoking. Place under the tongue, pocket, or just off center of the lower jaw. Okay. Again, you're going to need oral probably just for testing purposes. Since COVID-19, oral probably is not going to be used too much anymore. Okay. Tympanic. Okay. Know how to use tympanic. Okay. That is just in the ear. Okay. Really quick. That one will probably be used more since COVID-19 as well. Okay. Standard precaution. Okay. With rectal temperatures. Typically, we only do rectal temperatures on babies, 0 to 1, newborns to 1, okay? It's not necessarily we're going to do a rectal on an adult. That would be not good, all right? Slowly, gently insert the tip into the anus, 1/2 inch for infants, 1 inch for adults. Put a pin in that. That's something that you're going to need, all right? You're going to need to know those numbers, all right? Hold the thermometer in place while the temperature is taken. Remember, this is for somebody most of the time 0 to 1 years of age. Okay? Axillary, placed under the seated or lying position. Place the tip of the thermometer in the middle of the axillary of the shaft, facing forward. Probe must touch the skin on all sides, okay? So axillary would be right here under your armpit. I haven't done that in a very long time. That's not something you use, but if you were to use that, you probably use it on some maybe more of an adult or an older child that can hold their arm. Somebody that's 2 or 3, 0 to 2 or 3, they may be a little fidgety and not be able to use that method of taking the temperature, okay? Then you would use the temporal one anyway. All right. We're going to skip past this. Okay. Pulse, the number of heartbeats in 1 minute. I think we talked about the pulse being what? 60 to 100, okay, beats per minute. Most of the time, we take our pulse radially, okay, radially. A lot of times you'll see people when they're jogging, they'll take their pulse on the carotid pulse, carotid vein artery right here, okay? So they'll take it here. But most of the time, we'll take it on our wrist, and with 60 to 100, okay, is normal. Respirations is the number of times a patient breathes in 1 minute. Now, when you're watching a person for respiration, you're not necessarily going to touch them, but you kind of take it when they're not looking. So typically you can take their blood pressure, and while they're taking their blood pressure, you can watch them breathe in and out. Now, if they're in a panting motion, a lot of people get anxious when they go to the hospital or the doctor. So you got to kind of watch it, compare it to the norms, and move on, okay? So that number is going to be 16 to 20. 16 to 20, okay? One breath is one inhalation and one exhalation, okay? Don't worry about the ratio at this point. We'll get back to that. Indirect measurements of cardiac output, okay? We talked about tachycardia, bradycardia, weak and irregular, okay? Tachycardia would be a person with a pulse rate greater than 100. Bradycardia would be a...
Attention teachers, the configuration is back up. If you need assistance, come on down to the library.